Mr. Speaker, BC nurses are the backbone of our healthcare system, and without them, our troubled system is on the verge of complete collapse. That's why it's astonishing that this NDP government is cutting back on nurses' essential healthcare benefits. Nurses are stressed, they endure physical assaults, physical injuries from lifts, and instead of supporting them, this government is cutting their registered massage therapy benefits. Is the Minister of Finance really telling nurses that this government can't afford to pay for their essential health care benefits because of her fiscal incompetence?
Minister of Finance.
Thank you, Honourable Speaker. And the first thing, of course, that we all acknowledge is how important and highly valued the nurses working every day in our system are. And, Honourable Speaker, this member knows that I can't speak specifically to a situation that's happening at the bargaining table, but what I will say is that on this side of the House, we are deeply committed to making sure that we get a fair settlement to these nurses that are so important to our system, and we'll continue to do that work.
Member supplemental.
Minister doesn't want to confirm that. She doesn't want to confirm her $6,600 limo ride. She doesn't want to confirm her ministers, deputy ministers, and their car allowances. But you know, the problem is this government has so poorly managed their finances with their own decision-making. They're now coming for the extended health benefits of BC nurses. And when we raise issues like this, they love to try to say, well, you guys would just cut. So let's quote one of their members from Esquimalt Colwood, who says, members opposite suggest otherwise. They criticize our government by spending. They don't explain how their own plans will even pay for it. And I can tell you as a healthcare worker exactly how they would pay for it, on the backs of those workers, end quote. Well, it actually seems like it's this minister, this government, that's actually making the cuts on the backs, quite literally, of nurses, Mr. Speaker. Will the Minister of Finance admit she's mismanaged the economy so badly they are now pinching the pennies and taking away critical benefits for nurses' health and well-being?
Minister of Finance.
Honourable Speaker, it is ludicrous to hear this member suggest that it's on this side of the House that we are mistreating healthcare workers, Honourable Speaker. I'll tell you what, my very own grandmother was a cleaner in the Nanaimo Hospital. She scrubbed the floors in the emergency room. And you know what? At that time, people were paid union wages, and she raised, as a single mom, 3 kids on those wages, Honourable Speaker. What did the people on that side of the House do? They took those well-paying jobs and they privatized them. People who were making a decent living were making nickels, Honourable Speaker. You were there. You were there. You know what? You know as well as I do.
Members.
You voted for it. 16 long years. 16 long years. Who did you vote for those?
Members.
It's your time. You didn't.
Members. Minister has the floor.
Honourable Speaker, I understand that this member is running to be the new leader and he wants to distance himself from the BC Liberals or United or whoever you want to call yourself, but we know who you are, and the people in British Columbia know who you are, and you know what you did, and we know what you did, and you do it again on this side, and that's why we're over here.